Hello there, welcome to another episode of Sorosoke Physiotherapist. I'm Tony Oditola, also known as Miss Bash, and here with me is...
My name is Ife Olani.
So we are going to be talking about something that is quite controversial. It's pretty much about an engineer that had, what we call intersection syndrome. So he just developed weakness on the hand, and he just noticed that he was unable to lift objects, even when he goes to the site to correct and inspect, carry certain things to explain what he's doing to the workers at the site as a civil engineer. He couldn't do it. And I was wondering, what sort of problem is this? So, of course, when that kind of thing is happening, he reported at the hospital, he saw a doctor, and he was giving medications because he was not just unable to use the hand, he was also feeling pain. Pain was another key factor. It was another thing that was affecting him. So he went to see the doctor gave him medication. But he just noticed that I've been using medication for so long. This thing is not going. Like, if it was just there. So it was very concerning. Like, what's going on? It's not going. I've been using medications and all. So his wife now told him that, but my sister is a physiotherapist. Why don't you contact her? Let her come and check it out. Since she stays not too far from here, let her come and see what the problem is, what the issues are. So by the time, she went there and she examined the hand, everything that she suspected was what was going on. And the truth about it is that what you don't use, you lose. Because of the pain and limitation in function, he started to lose muscle mass, meaning the size of that entire limb was shrinking. Smaller. Yeah, it became smaller than the other arm. The entire limb, it was shrinking. And the pain was increasing because why? The hand was not getting enough support to do activities of daily living. So, of course, the pain will increase if the muscles are not working optimally. So that was what was happening. And he kept using medication. He actually did the right thing by going to the hospital, but the doctors did not refer him for physiotherapy. That was where the issue was.
You barely touched dinner last night. You need to eat properly today.
Site work doesn't wait for appetite. Deadlines are chasing me harder than you are.
Just try for me.
I will. Thanks.
Be careful at the site, okay?
Ever since I hit my hand on the wall, I've been having these serious pains at the base of my thumb to my forearm. I can't even lift this small toolbox. My hand feels so weak. Even my whole arm is weak.
This is becoming unbearable for me.
I have so much work to do, but I can't focus because the pain is too intense. I need to figure out a solution.
This is not good at all. I need to see a doctor immediately.
Hi, babe. I'm feeling sharp pain from the base of my thumb up to my forearm.
How did it happen? Have you taken anything for it?
Not yet. I'm leaving the office now to see a doctor.
Okay, please be careful and keep me updated.
I will, dear.
You've got some inflammation here.
Doctor, the pain is sharp and my hand feels very weak.
I see. I'd like to get a clear picture before prescribing anything. Please go and do your test and revert with the result.
All right, doctor. I've reviewed your test results. The inflammation is confirmed, but it's manageable. That's a relief. I'll prescribe some medications to help manage the pain and reduce the inflammation. Take them as directed and try to rest your hand as much as possible.
I'm sorry, my love. You'll be okay. I'm already making your favorite meal.
Thank you, my dear.
I've been taking these medications for so long. Yet nothing has changed.
I would love to make a suggestion. You know, my sister is a physiotherapist. I think we should inform her about your situation so she can come and check your hand. I'm very sure she can help.
Physiotherapist? At this point, I'm willing to try anything.
That's good. Let's try this option too. Please relax your hand for me. I can see mild swelling above the wrist. Sir, your affected upper limb is reducing in size. Your right arm is smaller than your left.
I didn't even notice that.
Sir, this is called intersection syndrome.
Intersection syndrome?
Yes, it is a painful inflammatory condition affecting the forearm and wrist. It is caused by repetitive friction where the first and second dorsal compartments of wrist extensor tendons cross. You need this wrist support. Use it mostly during activity to allow adequate healing to occur.
All right, I'll make sure to use it regularly.
And you must also follow up with strengthening exercises.
That's also noted.
Good. Pull this strap over the wrist and fasten it snugly.
Excellent. Keep going. These strengthening exercises will help restore your upper limb function.
I'm already feeling stronger.
After 6 weeks, Nathan had made remarkable progress. By staying consistent with his physiotherapy sessions
And faithfully following his home exercise program, he steadily regained strength and mobility. What once caused him pain had now become manageable, and his recovery was well on track.
After 6 weeks of consistent physiotherapy, Nathan is back at work. He's feeling much better now, strong, steady on his feet, and happy to be doing what he loves again.
I'm happy to be back. I used pills for so long, yet nothing changed. The doctor I met didn't even refer me for physiotherapy.
I never knew physiotherapy could make such a difference. I'm so glad I listened to you. Thank you for advising me to meet a physiotherapist.
I'm happy to see you getting better. That's all that matters.
I started with him. I gave him first of all, I worked on relieving the pain. I was actually the one seeing him. I worked on relieving the pain. The pain went down. Then we moved on to strengthening the weak muscles, because the muscles have to be strong enough to stabilize all the joints. So after doing that, I was very intentional about emphasizing the importance of home exercise programs, because you're not seeing this physiotherapist all the time, but you are with yourself more. Sometimes I will call over the phone, "Sir, are you doing your exercises?" Oh, you'll be like, "Oh yes, I'm trying my best." So at the first instance, aside relieving the pain, I got him a supportive device. There was this kind of support that is used for that particular condition. So he was wearing it most of the time. I advised him to always wear that support when he's active, doing things in the site or during his activities of daily living. But the support is not something he will use forever. So he used it during that period where we wanted the injured area to heal. And by the time it had healed properly, we focused a lot on strengthening the muscles and improving function altogether. So when he recovered, he was so grateful. He was like, "Oh," and I'd been taking pills. He was taking pills for a really long time. A really long time. And you can imagine the effect of just using medication on something that a physiotherapist can actually solve. Yes. So that brings me to talk about to our, healthcare professionals. We should work collaboratively. All right. I really appreciate medical doctors. It's an amazing profession. We work together. I'm friends with a lot of them, but some of them are not informed on what physiotherapists do. Many of them don't know who we are. Some of them know, but they just have vague knowledge on who physiotherapists are and what we do. But in a forum like this is to educate everyone, including healthcare providers, on what physiotherapists do, the kind of problems that we solve. So when you have a patient reporting to your hospital or your clinic with a problem that has to do with pain, movement, then you know this person would benefit from physiotherapy, especially when you rule out red flags, anything that has to do with, that affects systemic function, you rule out red flags. Then you observe that, this thing has to do with, the patient is not able to move,
yes,
and there is pain. That person will benefit from physiotherapy. So this issue has been something I've dealt with for many years, practicing for close to 20 years now, where you would see a patient and you would tell them, why did you wait this long before reporting here? Oh, I've been coming to the hospital. I've been seeing the doctor. I've been seeing orthopedic doctors. They never referred me for physiotherapy. These kind of things happen. So that's why we are educating everyone, especially healthcare providers. When these patients come to your facility or your clinic, refer them for physiotherapy. And the truth is, everybody is important in their own field.
yes,
Right? Because, I was sharing a story with you about a doctor that was trying to do one of the things that physiotherapists do. In fact, Ife even has a story to share in this scenario.
Okay, so usually when we practice, there's a particular machine that we use for electrical stimulation. So what we do is we place the electrodes on a particular area of the body and then we stimulate.
Yeah.
So it makes the hand move. So just by observing that, anybody will just feel, so all I just have to do is place this thing on the hand and switch it on, and then I get the same result. So there was a particular doctor that used to observe a physio that comes around, to see a particular patient and goes. So he felt that he could also use the machine. So one day like that, he had a patient that had a similar condition. So he didn't even bother reaching out to the physio, because he just felt like, this is a quick one I can just do for myself, So he put the machine, he did the whole thing, the hand didn't move. So it was a bit worried.
Electrode placement.
Yeah, so, and we place these electrodes as strategic points of the body. But,
to get the movement required.
So he didn't know. So when he saw that the whole thing was not giving him the feedback he needed, he just went to one corner of the hospital and said, hello, physio.
So, okay, the patient called the physiotherapist.
No, the doctor himself.
Oh, the doctor himself called the physiotherapist.
He went to call the physio. Hello, where are you? It's like, you have to come. You understand? So, because he just felt that just by observing that, it's not everything I'll need to be calling them for. I think I can handle this and handle that. But it goes beyond that. Because no matter how you want to look at it, something that you are not specially trained for, you might not be able to give maximum effectiveness as regards the treatment that will help that individual. So
honestly, you are totally right. I agree with you, because even as physiotherapists, with our experience in the hospital setting, many of us are conversant with some kind of medications that we feel, okay, this patient will benefit from this particular medication.
Yes.
But I will not write medication for any patient. It is not in my purview to do that. I am not licensed to prescribe medication for patients. It's not in my purview. It's not my specialty. A medical doctor, a specialist, a physician should prescribe medication. Likewise, a physiotherapist a doctor or an orthopedic surgeon or a neurologist or a physician cannot do the job of a physiotherapist. And I really appreciate medical doctors, orthopedic surgeons, fantastic profession. I respect them a lot. But everybody must stay in their own field so that the patient can get optimum treatment that would improve their health condition. It's just important that everybody stays in their lane so that the patient gets the best. We ought to work collaboratively. That is why I really admire a lot of surgeons, physicians, O&G doctors, orthopedic surgeons. As a matter of fact, I have a particular orthopedic surgeon that works collaboratively with Peakline Care, and it's been an amazing experience. You know, they respect our aspects of getting patients to move after surgeries, after orthopedic surgeries. So they understand the role of physiotherapy. However, we have some doctors that, yeah, they have an understanding, but the understanding they have is quite vague. They are not quite sure of, you know, the actual things physiotherapists do for patients. So they either, you know, skip it or feel it's not that important, but it is important, especially if a patient has had any kind of surgery. Post-operatively, they need to be managed by a physiotherapist, even if the patient is able to walk. There are certain things that they may have lost during the period where they had surgery or had been on admission. There's what we call deconditioning. So deconditioning, when that happens, there is weakness in the muscles, there is there could be stiffness in the joints, there could be pain. So that is where a physiotherapist comes in to restore function so that the patient or the client can do what he used to do prior to that surgery or prior to that incident. So it's so important that surgeons, doctors, healthcare providers refer patients for physiotherapy. Sorosoke Physiotherapy is solely sponsored by Peakline Care. Peakline Care is a physiotherapy center here in Lagos, Nigeria. We offer telemedicine services. We offer online and on-site physiotherapy services, framing vibrant, healthy people. That's what we do. Restore movement, relieve pain, improve function. So if you need physiotherapy services, kindly send us an email or click on the link to learn more, or give us a call or send us a message on WhatsApp. I have quite a number of pharmacists that have referred patients to me for physiotherapy. Pharmacists that have, you know, their own pharmacy where patients come to them.
Yes.
Like, you know, sometimes you would say pharmacists are primary healthcare providers.
Yes.
You know, people just go, let me go and buy medicine there. So when they notice that these patients would benefit from physiotherapy, they refer for physiotherapy. Yes. So sometimes it's not until a doctor refers.
Yeah.
Yeah. You want
then
to say
another
something?
thing I think also makes collaboration better is the kind of relationship that exists between the physios and the doctors. Some physios feel like I have a beef with the doctors, so they are doing their own thing. Some doctors too feel the same.
Yeah.
You know, they just feel physios are big, you know.
So
I feel like people should also take it up as a responsibility to interact, you know, with the other healthcare workers that they find themselves, you know, in the same environment with. For example, and that's why, and even if it stems down to the way some of our patients also receive us. I've heard patients before say, is physio this person around? Is the one I want to see me today, you know? So you can tell that there's a kind of cordiality that exists between the patient and the physio. So it also applies to the way some of these doctors also respect the physios. Because if there's already a beef, if you've given me an impression that you don't have empathy, if you've given me an impression that you don't care, I most likely would think twice before I refer any patient to you. So I feel like most people don't always pay attention to some of these subtle things. You understand? Absolutely. And I think nowadays, because when I did my affiliation in Igbobi, there was something called the consultant ward round that they do.
Yeah, so I've also attended during that ward round,
you have the consultant, you have a representative from the nursing department, you have a representative from the pharmacy department, physiotherapy department. So when we see a patient, the consultant will now ask, pharmacist, what do you think can help this person? So it's like a teamwork. Everybody is like, so while we are there, we get to decide who gets to see this person more based on the actual challenge that the person is being faced with. You understand? So relationship is also a factor that has been causing this lack of referrals.
I absolutely agree with you on that. It has been
causing a lot.
Because there is a particular orthopedic doctor that is my friend. I've known him for quite a while. And it's, you know, I've gotten referrals from him based on relationship. and most of the patients he refers to me, they always get good results.
Yes.
And he's amazed that, oh wow, he will tell me it's as though the magic hands. Do you understand? So based on that relationship, he's able to even refer more patients to me.
Yes.
But sometimes, if a medical practitioner doesn't really have any sort of friendship or relationship with a physiotherapist, or
you most likely will not cross their mind.
Or, they don't really know much about it. So it will most likely not cross their mind, or they've not even experienced physiotherapy themselves.
And sometimes it's funny, but some people inherit beefs. As funny as it sounds, some people beef each other.
Really happen.
In the health sector.
In the health sector.
So you just feel like, because this my oga doesn't like.
You see that beef that you are talking about. I will share an incident with you. Somebody was sharing it. It didn't happen directly where I work.
Okay.
But the person was saying that they were on a ward round, and the physiotherapy, they were reading the documentation that the physiotherapist did, and he requested for an x-ray. And the doctor now said, why is a physiotherapist requesting for x-ray? Why would a physiotherapist not request for an x-ray? Come on! The person has to see what is going on, whether it's in the spine or the knees or the hip, because of course we did anatomy in our training, our years of training. We did anatomy, so we need to understand what is going on.
Yes.
That's why, as physiotherapists, physics was a prerequisite for us. Physics, anatomy, biochemistry, physiology, all these things we did in our years of training. So it's important, and we also did posting in radiology, psychiatry, we did courses in psychology, just to make us have a robust experience. And in order to be fully equipped to give the best, to build capacity, to give the best to our patients. So I would like the doctors, the medical doctors, our healthcare providers to understand that nobody is trying to take up the job of anyone.
Yes.
Everybody is an excellent practitioner in their own field.
Yes.
Just ensure that the patient gets the best at that time.
Yes.
If physiotherapy is what the patient needs at that time, kindly refer. Sometimes, many of them may not even need surgeries, but some of them will still pitch surgeries to them before considering physiotherapy. And, it's not necessarily, it doesn't necessarily have to be that way.
Yes.
But, of course, sometimes when you see this patient condition, this person needs a surgery. Oh, this person needs a knee replacement. You understand? This person needs a hip replacement. Physiotherapy cannot fix this. Of course, by all means, refer, the patient to do, you recommend a surgery for such a client or patient. So, when a client or a patient reports at your hospital or clinic and you feel, okay, explore physiotherapy first. See how this goes for a couple of weeks or even months. And if it's not going away, then we'll look at either, changing medication, using intraarticular injections or other options, basically. Intervention or maybe surgery eventually. So it's just important that everybody values every professional in the healthcare team.
Yes.
We are all one, and our patients, they need us to know when to refer this patient or that patient to this particular specialist so that they can get the best. There's another, incident that happened in the O&G clinic. I was opportune to speak at an event in an O&G clinic, and the O&G doctors were amazed. They were like, oh, really? Physiotherapists can actually solve these kind of problems in women's health, in gynecological conditions? They were amazed. And in that moment, they started to refer some gynecological conditions to physiotherapists, where you would have a woman have pelvic pain. She doesn't know what's happening down there.
Yeah.
And these things are as a result of weak pelvic floor muscles. Patients that had uterine prolapse, several conditions.
Yes.
So educating them was something that was very beneficial at that point. And thereafter, the referral started coming in.
There's something I would also like to say. I would like to use this point to, just appeal to every health professional out there in general, that whatever maybe some other health professional might have done to you in the past. You just have to forgive. Because I heard of a case of someone who a physio managed, I think, his child at some point, and the physio did a bad job.
Wow.
So he has a personal issue with physiotherapists just because of that one physiotherapist. That can actually affect
a person's judgment about physiotherapy.
So he doesn't even want to hear what you have to offer as a physiotherapist. So he just feels that we are all the same. You understand? So I'm just using this medium to also appeal to because I won't say because a nurse. Okay, I remember there was a time I was at the hospital and I needed to take an injection, and I was young then. I was in secondary school, so I was so scared. But the nurse was so rude to me. She was like, "Better remove your trouser. If this thing breaks in your bum, you do surgery." You know, I passed out. As soon as the needle entered me, I passed out. So if I now hold on to that, and then I say all nurses
are bad.
I don't want to hear anything that has to do with a nurse. So if I have something that requires the service of a nurse, I would not involve her, Abby. You know, so life is not like that. Life isn't like that. So I feel like sometimes some of these things also stem from emotional issues. It's not even about whether they don't know what the physio can do or can't do.
They just feel that.
They just feel since I'm in charge, I would not refer because I'm in charge here. You understand? So sometimes it's not...
And it's not really about the person, that person. What does the patient need? What would the patient benefit from at that point, in that point
You'll be surprised that emotional...
And the truth is, that is not to say that they are physiotherapists. It's in every profession. We have lawyers that are bad. We have caterers that are bad. We have nurses that are bad. We have some doctors that are bad. We have some plumbers that are bad. And there we also have doctors that are good, nurses that are good, plumbers that are good, caterers that are good, physiotherapists that are good. There is no profession that do not have bad eggs. We have, as much as we talk about Nigeria, we also have good politicians. But we have bad politicians. But we have good politicians now. Don't let me start campaigning for some people here. We have some good politicians. Ife doesn't believe that there are good politicians in Nigeria. But you know, on a real, we have every profession have bad eggs and good eggs. So you can't, because of one particular experience with a bad egg, judge the other eggs. So give the good physiotherapist a chance. Refer that patient. You don't know what that referral is going to do. You don't know how it's going to transform that person's life. You don't know the impact it's going to make in that person's life, his family, his marriage, his future, his children.
It goes a long way.
It goes a long way. So it's beyond the personal differences or ego or anything of such. Just refer and let the person get the help that he or she needs. I believe this episode was very insightful and educative. Thank you very much. So at this point, we'll be bringing this podcast to a close. It was such an interesting podcast.
Yeah, I had fun.
Because we had to talk about doctors, nurses, and other professionals. Thank you all so much for joining us in this episode. Please do well to subscribe. Click the subscribe button. Like our videos, share with your friends, and make sure you stick around. Thank you for watching.
Yes.
Bye for now. Sorosoke Physiotherapist.
Bye.
Bye.